Hi, my name is Jillian, and I'm going to talk about the top two leading causes of death in the United States. So, the second leading cause of death is cancer. About 591,700 deaths in the United States are from cancer. Lung cancer is the most common in both men and women. For men, the second is prostate, and third is colon and rectum. For women, the second is breast, and the third is colon and rectum as well. So, what is cancer? Cancer is the uncontrolled growth of the abnormal cells in the body. It's when the body's normal control mechanism stops working. The old cells don't die and just grow and form new abnormal cells. These cells may form a mass tissue called a tumor. If this spread is not controlled, it can cause problems with life-sustaining systems like the heart or lungs and result in death. So, who can get cancer? Anyone can get cancer, but it can depend on exposure to carcinogens like smoke or genetic factors. This graph shows the incidence rates by race and ethnicity for males in the United States. This graph shows that black males have the highest amount of incidences. This next graph shows the incidence rates by race and ethnicity for females in the United States. The average of all races and whites remain the same. Can cancer be prevented? Most cancers can be prevented, like you would stop smoking to prevent lung cancer, stop drinking, and stop tanning, and use some sunblock to protect your skin from the sun. So how is cancer treated? There are 5 different ways you can treat cancer, but there is no specific cure because every body is different, every disease is different, but the most common treatment is chemotherapy. So this is just the use of medicines and drugs to treat cancer. Another form of treatment, which could be used along with chemo, is radiation. This is just using high energy particles or waves to damage cancer cells. Another form of treatment is surgery, and this is mostly when the cancer is in one part of the body and it can likely be removed. This would be like removing tumors. Another form is immunotherapy, and this stimulates one's own immune system to work harder to fight off the cancer cells. Lastly is targeted therapy, and this is a newer type of cancer treatment, and this is using drugs to precisely identify and attack cancer cells. Moving on to the top leading cause of death in America, heart disease. About 600,000 people die from heart disease every year, both men and women. That's about 1 in 4 deaths. Coronary heart disease, or CHD, is the most common heart disease. About 370,000 people die from coronary heart disease every year. That's more than half. In the United States, someone has a heart attack every 42 seconds. Each minute, someone in the U.S. dies from a heart disease-related event. What is heart disease? Cardiovascular diseases include coronary heart disease, stroke, high blood pressure, angina, and rheumatic heart disease. Like I said earlier, the coronary heart disease is the most common. This is the disorder of the blood vessels that can lead to heart attack. Heart attacks can happen when an artery becomes blocked with plaque, which is deposits of cholesterol and other substances, which prevents oxygen and nutrients from getting to the heart. I include the signs and symptoms of a heart attack because many are unaware of the symptoms and they don't know that they're actually getting one. So, if you feel chest pain or discomfort in the upper body, arms, neck, jaw, upper stomach, if you feel breathlessness or you have cold sweats, you might be having a heart attack. What puts people at risk? About half of Americans have at least one of these 3 risk factors: high blood pressure, high LDL cholesterol, or they smoke. Other conditions that increases risk for heart disease is diabetes, obesity, poor diet, physical inactivity, excessive alcohol use. So in this picture, it shows that the artery walls are becoming closer together because the plaque is blocking the way, so things can't go through it. I included the geographic demographics of the heart failure death rates in the United States, and as you can see by the key in the corner, that the dark red is highest annual death rates, and that is located mostly in the southern states. How can heart disease be avoided? It can be avoided by changing your lifestyle, eating healthier with lower sodium, lower total unsaturated fat, increasing physical activity, and quitting smoking. Medications can also help treat the risks by treating high blood pressure and high cholesterol. For 18 to 24-year-olds, the second leading cause of death is suicide. One death by suicide in the US happens every 13 minutes. On average, there are 121 suicides per day. Women attempt suicide 3 times as often as males, but men die by suicide 3.5 times more often than women. Although this is the second leading cause of death for 18 to 24-year-olds, younger groups have had consistently lower suicide rates than middle-aged and older adults. In this pie chart, it shows that firearms account for almost 50% of suicides. Next is suffocation, next is poisoning, and last is miscellaneous ways of suicide. Here is a graph of suicide rates by ethnicity, and you can tell that the American Indian or Alaskans have the highest amount of suicide rates. However, white males account for 7 out of 10 suicides. Moving on to the top leading cause of death for 18 to 24-year-olds. Accidents or unintentional injury. Nearly 200,000 people die from injury every year. That's 1 person every 3 minutes. This can mean violence and injuries, including car accidents, falls, and homicides. And this graph shows injury deaths compared to other leading causes. And we have reached the end of my PowerPoint. Thank you for watching.